Hi, I'm Long Beach Mayor Rex Richardson. Thanks for joining us today for our weekly live stream where we provide updates on our local homeless emergency. It's an ongoing platform to discuss issues related to homelessness and our emergency response. I want to start today by acknowledging the disturbing sexual assault incident that took place on Friday afternoon in our downtown. I want to express my sympathy to the victim and my thanks to the Good Samaritan who intervened. I also want to thank the first responders. Immediate action was taken. The individual was arrested within hours and is currently in custody. And we've received security footage. The response worked as it should. But to be clear, every resident deserves to feel safe as they walk through our community, any part of our community. And this incident is absolutely unacceptable. The reality is that the substance use challenges and mental health challenges are affecting downtowns across our region. And that's why I'll be asking for an enhanced focus on our downtown. This means an update on strategies to continue the strong recovery of our downtown with a focus on additional public safety measures. But we have to address the mental health and substance use challenges. So I'll be calling on the county for additional mental health and substance use resources in our downtown. And we remain in communication with our police department about the investigation and next steps to keep our community informed. Now, today, we'll have our guest on our weekly live stream as Kelly Colopy, who's our current health director. And Kelly is leaving the city at the end of the month to take a position to be closer with her family. But first, she's coming for one last live stream to talk about some of your progress and some of your legacy and some of the work that we're doing. So Kelly, you've been with us for a long time. I started in the city in 2010 as staff, and I remember when you started in 2013.
Yeah.
Mm-hmm.
Yeah, it's been a good solid 10 years, and it's just been absolutely an incredible opportunity and such a privilege to be with the city for sure.
Absolutely.
Yeah.
And so, over the past decade, what do you think? I mean, we've dealt with a lot from pandemics and really building our health department to be the modern health department that it is today. What stands out to you as sort of your legacy in this role?
Wow. Well, when we first started the health department in 10 years ago, we were much smaller.
Yeah.
So when I look at my org chart now, it used to be about this big, and now it's this big. So we have really grown as a health department overall, and I think it's really a testament to our staff and to our team, and really the incredible people coming through. But we were all in COVID together, right? We've all been a racial equity and reconciliation process together.
That's right.
We've been in a MPOX emergency together, and now we're in a homeless emergency together.
That's right.
So all that in the last three years.
Yeah, the emergency, the queen, the emergency queen.
The emergency queen.
What I'll tell you is, I remember those days.
Yeah.
When I was working on city council back in those days when you started, we were just focused on the basic amenities.
Yeah.
But now, as mayor and as I've seen our city build that capacity to address emergency responses, to be proactive on things like substance use, localizing mental health, STIs in our community. I'll tell you, it's a big feather in our cap to have a health department. And when I travel and when I talk with mayors and I talk about the city of Long Beach, I typically lead with, we're a public health city. And so we're one of 3 cities in the whole state with a public health department, right? Yeah. And so, now we're talking about, homelessness, and many cities don't have a health department. Yeah. So what does that mean for us that it's, homelessness is not typically a part of what a health department does, but it's what we do in Long Beach?
Yeah, I mean, we've been very lucky in Long Beach. In fact, a lot of the times, homeless services sits outside of the health department. It might be in a more social services environment. In LASA, it's its own organization. It could be a nonprofit organization. It looks very different. I've always stood with that housing and homelessness are people being housed is the most base level of your health and wellness. And so it is one of the most incredible opportunities to be able to pull all of that together, under one department, so that we can do like the early prevention work, starting from when someone is born to the work that we're doing now. I mean, we've got early childhood education, we have fatherhood, we've got the Office of Youth Development, we work in reentry, we've got maternal health, we've got, we've started started into the mental health. Thanks to you, we're now doing mental health coordination too. All of that is homeless prevention. And so to be able to make those connections all within one department is really just amazing.
And that's what makes our city special, that we have invested in these sort of social competencies. Whereas some cities are really good at, you know, I don't know, paving streets or whatever. Our city, we lean into those social issues and we think about root causes. And, you know, and as it relates to homelessness, we learned really quickly in 2017 that, you know, we had made a real impact on homelessness. But, you know, we had some challenges, and we saw that, you know, during the pandemic, the capacity we built, we were not prepared for an emergency of that size. But since then, I mean, we've seen it begin to taper off, right? So last year we saw that 62% increase come down to about 4%, 4.6, something like that, right? And now, and that's before the additional capacity we've done here on the local state of emergency. And so, you know, I would say, you know, what do you think we should be doing moving forward as, you know, as you transition to the next role? Where do you see this going as it relates to homelessness and public health?
Yeah, I mean, really, when you start to think about the key areas that we still really need to focus on, right? So those key spaces are, one, housing, right? So we need to continue to build and engage around the housing pieces. I think it's just, you know, people are homeless because they do not have a place to live. So how do we engage and do that work? I think the other pieces is that we, you know, as we've talked about, mental health and substance use are really challenging, and we just don't have that level of service that we need within the city. And so, you know, while only about 30% of people who are homeless have a mental health or substance use condition, the longer you're on the street, the more likely it could be, right, as you're going forward. So I think it's really essential that we continue to focus there. And then also just, you know, the work together, because it really is, it takes the whole city, right? So we do homeless services, right, that connection, but I think, you know, you also have to have all the other pieces together, and that's been a really outstanding piece of the emergency.
And that's important for us to understand. Homelessness, you know, we can address homelessness, and we can build housing, we can do outreach, and we can address, you know, issues with respect to, you know, poverty and things like that. But substance use and mental health, that's a county function, and cities don't traditionally do that. And now we're seeing this effort of localization, and we're starting from scratch in many ways, building up that capacity to deal with the issues like I referenced earlier today, right? So I'm encouraged seeing what the state is doing with you know, Mental Health Services Act reform and investing in more resource in the residential mental health and conservatorship reform and care courts. I'm encouraged to see the state is acknowledging their role and that counties also are stepping up to the plate. But you know, we need more engagement on the city level, because that's where the rubber meets the road. That's where the outreach is. So here's what I would.
We did just do the mental health plan. So
Absolutely.
We did bring that, and we do see a role for ourselves in that work. So we're working really hard to identify how we start to move that forward. And we're focusing on young people, we're focusing on families, we're focusing on people experiencing homelessness. And so all those things together, I think they are going to make a big difference as we're paying attention to what the state and the counties are doing.
And the average person at the grocery store, you know, they'll say, you know, Mayor, I know you're busy, we're with your kids, but while I got you here, right, they'll
Me too.
they tell you the same thing, right? They may not know the difference between what the city's responsible for and what the county or the state is responsible for. They hold us accountable for all of it, right? And so that's why it's important that we engage in substance use and mental health, and we understand how that impacts public safety, how it's all a part of the same experience. At the end of the day, people should be able to walk down their street and feel safe. If somebody falls on hard times, we should be able to help them find housing and get connected to a job. These are things that are not traditionally within the mandate of a city, but they are today in a modern city. So what would you say has been your greatest challenge as it relates to addressing homelessness?
Well, I think we've talked about it some, is, you know, really, I mean, first of all, COVID. So, you know, as a public health director, we focused on COVID, but COVID had some really just incredible impacts on people experiencing homelessness and people falling out of their housing because they didn't have jobs and other things. And we had a number of people who, like shelters, for instance, could hold 125 people, except that in COVID they only held 75. Right. So there were all these times where we knew how to do services, but we couldn't because of all the COVID restrictions. So that was a huge problem. And then the cost of housing is going up. It's more than $1,500 for a studio apartment, and so how do we start to really address that? So I think that's a big challenge going forward. And then again, just figuring out and bringing in more substance use and mental health supports. Great.
Well, I want to thank you for coming out, and I asked you about the challenges. I think I'm going to ask you now about your proudest moment as the Long Beach Department of Health and Human Services Director.
Yeah, I'll tell you, I have so many proud moments. I'm proud of my team every day.
You got a great team.
Yeah, I've got an incredibly great team. I think, the fact that we could pull together during the COVID pandemic, for the whole city and for the health department was just a fantastic accomplishment and really what we've been able to do. We've grown, as a department, we've grown from a department of about 300 and some people to almost 600 people, right? With the expansion, and then for homeless services, we've moved from about a $70 million shop to from about a $10 million shop to about a $70 million shop, and so bringing in all those services, and since 2020 we've opened 300 new shelter beds. I mean that's that's a lot. It's really impressive of what the team has been able to do, and just the fact that everybody has come together. So I think under this homeless emergency, it just allowed us to move forward even more. So we started in the COVID emergency, now we've got the homeless emergency, and we've been able to launch mobile access clinics, and we've been able to buy a building and get that done. We've been able to do we're bringing mental health and substance use treatment to the streets and things. So it's a real privilege to have been part of all of this together, and I'm proud every day of the department and what we've been able to do.
Well, I'll tell you, Kelly, those are difficult times, but we all remember those moments, and we all share those moments. Yeah. We all know where we were the moment we heard about the shutdown, right? And most folks are probably at home talking with their families, but you were, an emergency operations center helping set up infrastructure for people. Yeah. And I can just remember what it was like in those moments where you couldn't find toilet paper and groceries, and it was hard to talk about, what do you want to do, how to give information. And then on top of that, we had the circumstances around civil unrest and uprising around racial equity. And in those moments, that's when the leadership came out. We saw your leadership, we saw our previous mayor's leadership, the council. I remember, being at home watching buildings burning and Long Beach being focused, on news regionally. And I just sent out a tweet and said, get your shovels and get your brooms and meet me at, this corner at 7 a.m., right, with Downtown Long Beach Associates and others. Yeah. And we were astounded with the response. Thousands of people showed up the next morning, sweeping up glass and painting out graffiti and boarding up windows. And we had every window boarded up by 2 o'clock in North, Central, and West Long Beach, every impacted area. So those are the things that I remember, and I remember at every step of the way, our health department has had to step up. So I want to congratulate you for leading really one of the nation's best health departments here in Long Beach. And we certainly have big challenges, but I feel encouraged by those experiences that we've had. I have no doubt that we will, since we have this great deal of alignment between the state and the city and the county, we'll get through those challenges. But it's the cities that rally, it's the cities that have that spirit of unity. Those are the ones that are going to overcome our big challenges first. So I just want to, just thank you for your leadership. So I want to, at this point, we want to thank Kelly Colopy for being here with us today. We're going to, begin our process of appointing a new Director of Health and Human Services. But in the meantime, Alison King, who currently heads the Housing Authority, will be stepping into the role on an interim basis. Alison is a great person, incredibly focused, incredibly smart. It was her team who helped lead housing 583 people during the emergency with the new emergency housing vouchers. And we got that going, and we're able to be one of the first jurisdictions in California to reach 100% utilization. And that was a huge goal, but it was Alison, it was her team and other city partners that worked together to get it done. I mean, we met with landlords, we picked up the phone and called landlords. The Housing Authority really got that work done. And recently they were awarded 79 additional housing stability vouchers that can also be used to house people experiencing homelessness. So while we thank Kelly, we welcome Alison into this new role.
Yeah. So Alison's stepping in. We've got more than 55 programs in the health department. She does have a public health background, so she's been working in public health for 7 years before she became focused on housing. So she's a great leader to be able to step in, and she's been a trusted partner to me through all of this work, and so real happy for her.
Good, good. Well, thank you again for your incredible work over this past decade, for stewarding us through these challenges of the local homeless emergency and COVID. You'll certainly be missed, but we wish you the best of luck in your new role. And before we conclude, I want to remind everyone that we have an online community meeting coming up on tiny homes, coming up next Monday, October 30th. That's 33 additional units that we're deploying, tiny homes. And to register for that meeting, visit longbeach.gov/tinyhomes. Now we'll conclude and proceed to interpretation in Spanish and Khmer. Thank you.
Buenos días a todos y gracias por unirse a nosotros para nuestra transmisión en vivo semanal, donde ofrecemos actualizaciones sobre la situación de emergencia. En el día de hoy, el alcalde comenzó la transmisión diciendo que esta es una plataforma que utilizamos para actualizar las situaciones de emergencia locales. Y comenzó diciendo que quería reconocer el incidente perturbador de agresión sexual que ocurrió el viernes. Quería expresar su solidaridad para la víctima y agradecer al buen samaritano que intervino y agradecer también a las autoridades de respuesta que tomaron una acción inmediata y arrestaron, y la persona fue arrestada algunas horas después y en este momento está detenida. También dijo que recibimos la copia del video y la respuesta funcionó como debería haber sido. Pero quiere dejar en claro que cada residente necesita sentirse a salvo y seguro al caminar en la comunidad y que este incidente es inaceptable y que la realidad es que el consumo de sustancias y los problemas de la salud mental son muy serios y son desafíos que están afectando los centros de la ciudad y a lo largo de toda nuestra región. Por esa razón, enfatizó el alcalde que está pidiendo mejoras y que se ponga enfoque en el centro de la ciudad. Esto se traduce en actualizar estrategias para continuar con una fuerte recuperación del centro de la ciudad. Con enfoque en medidas adicionales de seguridad pública. Esto también significa llamar al condado para obtener recursos adicionales para la salud mental y para la prevención del uso de sustancias. Y que además, dijo el alcalde, que siguen en comunicación con el Departamento de Policía sobre la investigación y los próximos pasos de este caso. En el día de hoy, en la retransmisión de actualización de la situación de emergencia de las personas sin hogar, el alcalde estuvo acompañado por Kelly Colopy, nuestra directora del Departamento de Salud, y el alcalde mencionó que esta era una transmisión un poco agridulce porque a fin de mes la señora Kelly Colopy dejará de trabajar con la ciudad para ocupar un puesto nuevo y estar más cerca de su familia, y que además era la última retransmisión trabajando juntos. La señora Kelly ha estado trabajando en la ciudad desde 2013 y ha ayudado mucho a la ciudad, especialmente en la última década y especialmente en los últimos 3 años. Más gente ha tomado conciencia de lo que hacemos aquí en salud pública y el papel que desempeñamos en ayudar a la gente en toda la ciudad, dijo el alcalde. No necesariamente es típico que los servicios para las personas sin hogar formen parte del Departamento de Salud. es bastante raro en California. Los servicios para las personas sin hogar pueden estar en varios departamentos, como servicios humanos, servicios sociales, o tener su propia organización, como en el condado de Los Ángeles. Y a veces incluso lo gestiona una organización sin fines de lucro. Aquí en Long Beach, la salud y los servicios humanos forman parte de un departamento único que nos ayuda a trabajar para prevenir la falta de vivienda a través de nuestros muchos programas de salud pública y servicios humanos, así como para poder hacer frente a la falta de vivienda de las personas sin hogar. Cuando dijo Kelly que cuando llegó a la ciudad hace una década, los servicios para las personas sin hogar era algo nuevo para ella. Y aunque había supervisado muchos programas que ayudan a las personas a salir de la indigencia, tuvo mucho que aprender. En 2017, dijo la señora Kelly, el número de personas sin hogar se había reducido a más del 50% comparado con 2007. Durante ese año, nuestro recuento puntual detectó 1.863 personas sin hogar y nuestras cifras se mantuvieron en ese nivel hasta que la pandemia desbarató todo. Dijo que además tuvieron que enfrentar muchos desafíos y sobre todo cuando se tuvo que enfrentar a la pandemia del coronavirus. En ese momento se habían retirado muchos de los servicios importantes, especialmente los que se ofrecían en persona, y además se redujo el número de personas que cada albergue podía acoger debido a los protocolos de seguridad. Además, muchas personas perdieron su trabajo durante el coronavirus, mientras que los costos de los alquileres seguían aumentando. Un departamento de un ambiente, los llamados estudios, en nuestra ciudad suele costar ahora más de $1.500 al mes. Esto es inaccesible para las personas que ganan el salario mínimo. Y esto ha hecho que cada vez más personas necesiten vivienda y servicios. También nos damos cuenta, dijo, que no hay suficientes servicios de salud y tampoco para la salud del comportamiento disponibles para poder satisfacer las necesidades de las personas sin hogar, que estaban trabajando para atraer más de estos servicios a la ciudad. Con la situación de emergencia de las personas sin hogar, se pudo conseguir aún más con la proclamación, ¿no?, de la situación de emergencia. En lo mejor de los casos, no hubiésemos necesitado hacer la proclamación, pero me alegro de que el ayuntamiento haya actuado, dijo la señora Kelly Colopy. Durante el periodo de emergencia hemos podido simplificar y agilizar los procesos y movilizar los recursos con más rapidez que nunca, dijo. Esto se debe a la flexibilidad que permitió la proclamación de emergencia, sino también que hemos reunido a las mejores y más brillantes personas de nuestra ciudad en todos los ámbitos para que pongan las manos en la obra a identificar soluciones. Hemos comprado un edificio y abierto un refugio, hemos puesto en marcha camas adicionales para poder enfrentar el frío durante las lluvias y el frío del invierno como el año pasado. Y también hemos abierto estacionamientos seguros, hemos puesto en marcha el centro del acceso móvil y mucho más. Es realmente asombroso lo que hemos logrado conseguir en tan poco tiempo juntos y ha sido un privilegio servir como comandante de incidentes junto al equipo de la ciudad, dijo la señora Kelly Colopy. Cuando termine el estado de emergencia, sé que las relaciones desarrolladas durante este periodo continuarán a medida que avancemos hacia el próximo plan estratégico para las personas sin vivienda, centrado en la prevención, los servicios y la vivienda de las personas que están en situación de indigencia. Una de las personas claves en la situación de emergencia de las personas sin vivienda, asumirá el cargo de directora del Departamento de Salud y Servicios Humanos la semana que viene, mientras se lleva a cabo el proceso selectivo nacional del próximo director o directora, dijo el alcalde. Alison King, que actualmente dirige el Departamento de Autoridad de Vivienda, asumirá el cargo. Alison es una gran persona, increíble, centrada e inteligente. Alison también tiene todas las calificaciones para hacer ese trabajo y ella ha estado trabajando en la vivienda durante varios años, pero en realidad tiene antecedentes en salud pública, ya que trabajó previamente en el Departamento de Salud Pública del Condado como administradora de un programa durante más de 7 años, antes de pasar a trabajar en el programa de vivienda accesible, dijo el alcalde. Antes de concluir, me gustaría recordar a todos que tenemos una reunión de la comunidad en línea sobre las tiny homes o casas pequeñitas el próximo lunes 30 de octubre. Para inscribirse, visite longbeach.gov/tiny homes. Muchas gracias.
Bosom chumri su bong pon tang ak ni hai yung khnyom som swakum bong pon dal kampung te tam dan trong trap sdap nang tesana ka phsai bata ptol ប្រចាំសប្តាហ៍របស់កម្មវិធីដោះស្រាយបញ្ហាវិបត្តិដែលពាក់ព័ន្ធនឹងរឿងអនាថានៅក្នុងទីក្រុងឡុងប៊ីចរបស់យើងជាកិច្ចចាប់ផ្ដើមនេះមុននឹងចូលដល់កម្មវិធីរបស់យើងលោកអភិបាលក្រុងឡុងប៊ិចសូមប្រកាសដឹងឮអំពីហេតុការណ៍នៃការបៀតបៀនផ្លូវភេទដ៏គួរឲ្យរំខានមួយដែលបានកើតឡើងកាលពីរសៀលថ្ងៃសុក្រកន្លងទៅលោកបានប្រកាសសម្ដែងសមានចិត្តអាណិតអាសូរដល់ជនរងគ្រោះហើយក៏លោកសូមថ្លែងអំណរគុណដល់បងប្អូនប្រជាពលរដ្ឋដែលបានចូលជួយពេលដែលមានបញ្ហានោះកើតឡើងលោកក៏បានថ្លែងថាលោកក៏សូមអរគុណជាពិសេសដល់ទៅមន្ត្រីសមត្ថកិច្ចដែលចុះអន្តរាគមន៍ភ្លាមៗជួយដល់ជនដែលរងគ្រោះហើយនឹងចាប់ជនដៃដល់ដាក់នៅឃុំបាទឥឡូវនេះមកដល់ពេលនេះគឺជនដៃដល់ត្រូវបានឃាត់ខ្លួនហើយបានកំពុងតែស្ថិតនៅក្នុងការឃុំឃាំងរបស់ប៉ូលីសគឺចាប់បាននៅប្រមាណម៉ោងក្រោយកើតហេតុបាទយើងក៏ទទួលបានវីដេអូពីកាមេរ៉ាសុវត្ថិភាពហើយលោកក៏បានប្រកាសថាអ្វីដែលជាសារដែលគួរឲ្យច្បាស់ជម្រាបជូនប្រជាពលរដ្ឋនៅក្នុងសហគមន៍ថាប្រជាពលរដ្ឋទាំងអស់ត្រូវទទួលបានសុវត្ថិភាពទាំងផ្លូវកាយនិងផ្លូវចិត្តនៅក្នុងពេលធ្វើដំណើរនៅក្នុងសហគមន៍របស់យើងជាពិសេសធ្វើដំណើរដោយថ្មើរជើងនៅក្នុងសហគមន៍ហើយហេតុការណ៍ដែលបានកើតឡើងនេះគឺមិនអាចទទួលយកបានទាល់តែសោះហើយតត្តភាពជាក់ស្ដែងរបស់យើងលោកបញ្ជាក់ថាគឺបញ្ហាគ្រឿងញៀននិងជំងឺផ្លូវចិត្តដែលនៅតែបន្តប៉ះពាល់ដល់ទីតំបន់ប្រជុំជនឬក៏ downtown នៅគ្រប់ទីកន្លែងនៅក្នុងតំបន់របស់យើងហេតុការណ៍នេះក៏លោកបានបញ្ជាក់ទៀតថាយើងស្នើឲ្យពង្រឹងឲ្យមានការយកចិត្តទុកដាក់បន្ថែមទៀតនៅក្នុងតំបន់ downtown ហើយនឹងក្នុងនេះក៏មានន័យថាកែលម្អយុទ្ធសាស្ត្រដើម្បីស្ដារតំបន់ downtown ឲ្យរឹងមាំឡើងវិញដោយបន្ថែមវិធានការសុវត្ថិភាពសាធារណៈផងហើយនៅក្នុងនោះលោកក៏បានស្នើឲ្យថ្នាក់ដឹកនាំក្នុងតំបន់បន្ថែមធនធានបន្ថែមដើម្បីដោះស្រាយបញ្ហាគ្រឿងញៀននិងជំងឺផ្លូវចិត្តហើយជាចុងក្រោយលោកបានបញ្ជាក់ថាលោកកំពុងតែតាក់ទងនៅផ្នែកប៉ូលីសដើម្បីធ្វើការស៊ើបអង្កេតបន្តក្នុងករណីនេះបាទថ្ងៃនេះយើងចូលដល់កម្មវិធីយើងតែម្ដងគឺលោកអភិបាលក្រុងឡុងប៊ិចលោក Rex Richardson ចាត់ទុកការផ្សាយថ្ងៃនេះថាជាកម្មវិធីរំជួលចិត្តបិទភ្ញៀវកិត្តិយសរបស់យើងដែលចូលរួមថ្ងៃនេះគឺជាថ្ងៃចុងក្រោយរបស់អ្នកស្រីនៅក្នុងការបម្រើការងារនៅទីក្រុងឡុងប៊ិចរបស់យើងអ្នកស្រី Kelly Colopy ជានាយិកានាយកដ្ឋានសុខាភិបាលបានលាឈប់ពីការងារនៅសាលាក្រុងឡុងប៊ិចនិងត្រូវទៅកាន់មុខតំណែងថ្មីដើម្បីបានទៅជួបជុំគ្រួសាររបស់អ្នកស្រីវិញបន្ទាប់បីជាយ៉ាងនេះក្តីអ្នកស្រី Kelly Colopy ដែលចូលបម្រើការនៅសាលាក្រុងឡុងប៊ិចនៅនាយកដ្ឋានសុខាភិបាលតាំងតែពីឆ្នាំ2013នោះមកចូលរួមនៅក្នុងកម្មវិធីផ្សាយបន្តផ្ទាល់របស់យើងដើម្បីជម្រាបលាបងប្អូនទាំងអស់គ្នាផងនិងជម្រាបជូនដំណឹងអំពីការងារកន្លងមកដែលអ្នកស្រីនិងសហការីបានបំពេញដើម្បីបម្រើសហគមន៍ទីក្រុងឡុងប៊ិចរបស់យើងផងអ្នកស្រីមានប្រសាសន៍ថានៅក្នុងរយៈពេល1ទសវត្សរ៍កន្លងមកនេះជាពិសេសនៅក្នុងរយៈពេល3ឆ្នាំចុងក្រោយនេះប្រជាពលរដ្ឋយើងលោកដឹងច្រើនអំពីអ្វីដែលយើងធ្វើនៅផ្នែកសុខាភិបាលនៅទីនេះពលរដ្ឋក៏លោកជ្រាបអំពីទូនាទីរបស់យើងដែលបំពេញនៅក្នុងការជួយប្រជាពលរដ្ឋយើងនៅទូទាំងទីក្រុងអ្នកស្រីបន្ថែមទៀតថារឿងអាណាថាគឺជាផ្នែកមួយសំខាន់ដូចជាផ្នែកសំខាន់ដទៃទៀតដែរនៃនាយកដ្ឋានសុខាភិបាលដែលយកចិត្តទុកដាក់បំផុតក៏ប៉ុន្តែអ្វីដែលជារឿងកម្រនៅរដ្ឋកាលីហ្វ័រញ៉ាយើងនេះគឺសេវាជនអាណាថាមានបញ្ចូលនៅក្នុងផ្នែកផ្សេងៗនៅក្នុងនាយកដ្ឋានសុខាភិបាលដូចជាផ្នែកសេវាប្រជាពលរដ្ឋសេវាសង្គមនិងមានអង្គការផ្ទាល់ខ្លួនដូចជាតំបន់ LA County ដែលដោះស្រាយតែបញ្ហាអាណាថានិងជួនកាលក៏មានអង្គការសង្គមស៊ីវិលដែលមិនរកប្រាក់កម្រៃមានគ្រប់គ្រងកម្មវិធីជួយជនអាណាថាទាំងនេះថែមទៀតផង បាទនៅទីនេះគឺនៅទីក្រុងឡុងបិចរបស់យើងសេវាសុខាភិបាលនិងប្រជាពលរដ្ឋគឺស្ថិតនៅក្នុងនាយកដ្ឋានតែមួយដែលជួយយើងនៅក្នុងការបង្ការភាពអនាថាតាមរយៈកម្មវិធីផ្តល់សេវាសុខភាពសាធារណៈនិងសេវាប្រជាពលរដ្ឋជាច្រើនដែលក្នុងនោះមានទាំងសេវាដោះស្រាយបញ្ហាជនអនាថានេះផងអ្នកស្រីបន្ថែមទៀតថានៅពេលដែលអ្នកស្រីមកដល់ទីក្រុងឡុងបិចកាលពី10ឆ្នាំមុនសេវាជនអនាថានេះគឺជារឿងថ្មីមួយចំពោះអ្នកស្រីបើទោះបីជាអ្នកស្រីធ្លាប់គ្រប់គ្រងកម្មវិធីជាច្រើនដែលជួយរំដោះមនុស្សឲ្យរួចផុតពីភាពអនាថាយ៉ាងណាក្តីបាទអ្នកស្រីថាអ្នកស្រីបានរៀនសូត្រច្រើនអំពីបទពិសោធន៍ការងារនេះត្រឹមឆ្នាំ2017បញ្ហាអនាថាបានថយចុះមកនៅជាងក្រោម 50% បើធៀបទៅនឹងឆ្នាំ2007អ្នកស្រីមានប្រសាសន៍ទៀតថានៅឆ្នាំនោះការរាប់ចំនួនជនអនាថាដល់ទីកន្លែងបានរកឃើញថាមានប្រជាពលរដ្ឋ1863នាក់កំពុងរស់នៅក្នុងស្ថានភាពអនាថានិងចំនួននេះនៅថេររហូតដល់មានវិបត្តិជំងឺ COVID-19 មកដល់ដែលធ្វើឲ្យអ្វីៗប្រែប្រួលយ៉ាងខ្លាំងអ្នកស្រីថាបញ្ហាប្រឈមជាច្រើនជាពិសេសរឿងទប់ទល់នឹងបញ្ហា COVID នេះបានធ្លាក់មកលើនាយកដ្ឋានសុខាភិបាលជាអ្នកដោះស្រាយពេញបន្ទុកនៅពេលនោះអ្នកស្រីថាសេវាសំខាន់ជាច្រើនត្រូវដកចេញវិញជាពិសេសសេវាដែលចោះជួយដល់ទីតាំងផ្ទាល់នៅទល់មុខបើទោះបីជាដែលចោះទៅជួយដល់គោលដៅទល់មុខគ្នាតែម្ដងក៏ត្រូវបានកាត់បន្ថយដោយសារតែបញ្ហារក្សាគម្លាតហើយទីជម្រកបណ្ដោះអាសន្ននីមួយៗក៏ថយមនុស្សនៅស្នាក់នៅដែរដោយសារតែក្រិតក្រមថ្មីដើម្បីទប់ទល់នឹងការរីករាលដាលនៃជំងឺ COVID-19មិនតែប៉ុណ្ណោះអ្នកស្រីបន្តថាមានមនុស្សជាច្រើនបានបាត់បង់ការងារនៅក្នុងអំឡុងនៃស្ថានភាពជំងឺ COVID-19 នៅក្នុងពេលជាមួយគ្នានោះថ្លៃផ្ទះជួលក៏កើនឡើងខ្ពស់បន្ទប់ជួលមួយបន្ទប់នៅក្នុងអគារផ្ទះល្វែងនៅក្នុងទីក្រុងឥឡូវថ្លៃជាង$1,500នៅក្នុងមួយខែអ្នកស្រីថាបញ្ហានេះធ្វើឲ្យប្រជាពលរដ្ឋយើងដែលរកបានប្រាក់ឈ្នួលអបបរមាមិនអាចលៃលករកបន្ទប់ជួលដើម្បីស្នាក់នៅបាននឹងគេនោះឡើយដូច្នេះហើយទើបធ្វើឲ្យអ្នកដែលត្រូវការលំនៅឋាននិងសេវាលំនៅឋាននេះកើនឡើងជាលំដាប់បាទស្របពេលជាមួយគ្នាអ្នកស្រីថាយើងរកឃើញផងដែរថាក្រុងពុំមានសេវាសុខាភិបាលនិងសេវាសុខភាពផ្លូវចិត្តឲ្យបានគ្រប់គ្រាន់ដើម្បីឆ្លើយតបទៅតាមសេចក្តីត្រូវការរបស់ប្រជាពលរដ្ឋបងប្អូនយើងដែលជាជនអនាថានោះដែរម្ល៉េះហើយបានជាយើងត្រូវធ្វើយ៉ាងណាដើម្បីបង្កើតសេវាទាំងនេះឲ្យមាននៅក្នុងទីក្រុងរបស់យើងបាទអ្នកស្រី Kelly បានមានប្រសាសន៍បន្តទៀតថាដោយមានបញ្ហាប្រកាសអាសន្នអំពីវិបត្តិនៃភាពអនាថាយើងមានលទ្ធភាពសម្រេចកិច្ចការកាន់តែច្រើនជាងមុនអ្នកស្រីបន្តថាការប្រកាសអាសន្នអំពីវិបត្តិនៃភាពអនាថាមែនទៅគឺជាសារអវិជ្ជមានមួយទេដែលមែនតែនមិនគួរកើតមានក៏ល្អដែរក៏ប៉ុន្តែអ្នកស្រីរីដែលសាលាក្រុងប្រកាសដាក់បញ្ហាអនាថាជារឿងអាសន្នដែលត្រូវដោះស្រាយនៅក្នុងអំឡុងពេលនៃការប្រកាសអាសន្ននេះអ្នកស្រីបន្ថែមថាយើងបានពង្រឹងនិងពង្រីកដំណើរការនិងការកែធនធានដើម្បីជួយដោះស្រាយបញ្ហាឲ្យបានលឿនជាងពេលណាទាំងអស់ទាំងនោះគឺមិនត្រឹមតែដោយសារតែភាពបត់បែននៃការប្រកាសអាសន្នដែលយើងអាចធ្វើដូច្នេះបាននោះទេគឺដោយសារតែសាលាក្រុងយើងមានភាពសាមគ្គីគ្នាជាធ្លុងមួយដោយសហការគ្នាគ្រប់នាយកដ្ឋាននិងស្ថាប័នដើម្បីចូលរួមរកដំណោះស្រាយរួមមួយមិនតែប៉ុណ្ណោះអ្នកស្រីថាយើងទិញអគារមួយហើយបើកឲ្យដំណើរការទីជម្រកសម្រាប់ជនអនាថាយើងបានដាក់ឲ្យដំណើរការអគារដែលមានគ្រែសម្រាប់បងប្អូនអនាថាជ្រកកោននៅក្នុងរដូវរងារដូវភ្លៀងនិងខែដែលធ្លាក់ខ្យល់ត្រជាក់ភ្លាមយើងបានបើកឲ្យដំណើរការកន្លែងចតរថយន្តដែលមានសុវត្ថិភាពសម្រាប់បងប្អូនអនាថាហើយយើងក៏បានបើកឲ្យដំណើរការមជ្ឈមណ្ឌលផ្ដល់សេវាចល័តនិងច្រើនជាងនឹងទៀតរឿងនេះគឺជារឿងដ៏អស្ចារ្យណាស់ព្រោះយើងសម្រេចសមិទ្ធផលបានយ៉ាងច្រើនអនេកនៅក្នុងពេលដ៏ខ្លីបំផុតអ្នកស្រីបន្តទៀតថាអ្នកស្រីមានកិត្តិយសដែលបានបម្រើការជាអ្នកបញ្ជាក្រុមដោះស្រាយបញ្ហារបស់ក្រុងឡុងបិចអ្នកស្រីបន្ថែមថានៅពេលដែលប្រកាសអាសន្ននេះត្រូវបិទបញ្ចប់ទៅវិញអ្នកស្រីដឹងថាទំនាក់ទំនងដែលបានកសាងនៅក្នុងអំឡុងពេលនេះនឹងនៅតែបន្តព្រោះអីយើងកំពុងតែរំកិលទៅរៀបចំផែនការយុទ្ធសាស្ត្របន្ទាប់ទៅទៀតសម្រាប់ដោះស្រាយបញ្ហានៃភាពអនាថាដែលផ្ដោតលើវិធានការបង្ការកុំឲ្យប្រជាពលរដ្ឋធ្លាក់ខ្លួនក្លាយជាជនអនាថានិងផ្ដល់សេវានិងលំនៅឋានសម្រាប់បងប្អូនជនអនាថាបាទនៅក្នុងពេលដែលអ្នកស្រី Kelly លាឈប់ពីការងារផ្នែកសុខាភិបាលក្រុងឡុងបិចនេះលោកអភិបាលក្រុងឯណោះវិញបានថ្លែងថាមានមន្ត្រីសកម្មម្នាក់នៅក្នុងផ្នែកនៃការជួយដោះស្រាយបញ្ហាបន្ទាន់នៃភាពអនាថានឹងចូលមកកាន់តួនាទីជាប្រធានស្ដីទីផ្នែកសុខាភិបាលនិងសេវាប្រជាពលរដ្ឋអ្នកដែលមកជំនួសអ្នកស្រីជាបណ្ដោះអាសន្ននៅក្នុងពេលដែលសាលាក្រុងកំពុងតែរើសនាយិកាថ្មីសម្រាប់នាយកដ្ឋានសុខាភិបាលនោះមានឈ្មោះថាអ្នកស្រី Alison King លោកបន្តថាអ្នកស្រី Alison King សប្តាហ៍ថ្ងៃជានាយិកានាយកដ្ឋានអាជ្ញាធរលំនៅឋានលោកកោតសរសើរអ្នកស្រី Alison ដែលចាត់ទុកអ្នកស្រីថាជាស្ត្រីឆ្នើមដ៏ម៉ឺងម៉ាត់ច្បាស់លាស់និងឆ្លៀសវៃបំផុត អ្នកស្រី Kelly ឯនោះវិញក៏យល់ស្របថាអ្នកស្រី Alison មានលក្ខណៈសម្បត្តិល្អគ្រប់គ្រាន់ដែលស័ក្តិសមបំផុតនឹងការងារនេះដែរព្រោះអ្នកស្រី Alison បានបម្រើការនៅក្នុងផ្នែកលំនៅឋាននេះអស់រយៈពេលជាច្រើនឆ្នាំមកហើយក៏មិនតែប៉ុណ្ណោះអ្នកស្រីមានសញ្ញាបត្រផ្នែកសុខាភិបាលសាធារណៈនិងធ្លាប់ធ្វើការនៅនាយកដ្ឋានសុខាភិបាលប្រចាំតំបន់នៅក្នុងឋានៈជាមន្ត្រីរដ្ឋបាលអស់រយៈពេលជាង7ឆ្នាំមុនអ្នកស្រីមកកាន់ការផ្នែកលំនៅឋានដែលមានតម្លៃធូរថ្លៃនេះជាចុងក្រោយលោកអភិបាលក្រុងឯនោះបានរំលឹកបងប្អូនប្រជាពលរដ្ឋនៅក្នុងឡុងបិចទាំងអស់ថាសាលាក្រុងនឹងមានកិច្ចប្រជុំសហគមន៍តាមអនឡាញមួយអំពីគម្រោងផ្ដល់កូនផ្ទះឬ Tiny Homes ដែលនឹងធ្វើនៅថ្ងៃច័ន្ទទី30 ខែតុលាសប្តាហ៍ក្រោយនេះបាទលោកស្នើឲ្យបងប្អូនដែលចង់ចូលរួមគឺសូមចុះឈ្មោះដោយចូលទៅគេហទំព័រនេះគឺ longbeach.gov/tinyhomesបាទយើងខ្ញុំសូមអរគុណលោកនាងទាំងអស់ដែលបានត្រងត្រាប់ស្ដាប់និងទស្សនាការផ្សាយបន្តផ្ទាល់របស់យើងបាទខ្ញុំបាទសូមជម្រាបលា